Good morning. It's Dr. Cadle here. We're continuing our series on low back pain. So in my first post, talked about some things to do if you're standing for long periods. So we're going to talk a little bit more today about positions when standing, thinking about the pelvis, and then we're also going to get into some standing hip flexor stretches. The hip flexors are a common trouble area for low back pain, and these often get inflamed when we are sitting for long periods. So folks that drive, folks that have a desk job, or just end up sitting at home, these can really be a problematic area. So the hip flexors, just like their name sounds, they flex the hip. So they run from the front of the upper thigh and tie into the low back up into the level of about that rib cage in the back. So if you feel in the back, you can feel where your ribs end, they go all the way up there. So they really can cause some havoc in the low back if you have been sitting where they are in their shortest position and then you're trying to stand up or stretch. So similar to the gentleman that was in the meme picture that I had on that first post, oftentimes patients are like, I just can't straighten up, or when I do, I get that pain in the low back. When I'm going from sitting to standing, I feel the pain. Those are often indicators to me that hip flexors are probably at play. And like I said, when I'm treating folks, I often find them to be tight. So we'll talk first a little bit about some standing things to do. So we already talked about a few different things, having the box, making sure to kind of keep a little bend in the knees, which helps with the pelvis. And that's the area we kind of want to talk about. So standing, giving that bend in the knees helps to rock that pelvis forward, which helps to keep the hip flexors in a good position. The other thing is when we let the pelvis rock back, we cause a pinch in that sacrum lumbar spine juncture, the lumbosacral junction. So where those two areas meet, and that can cause a pinching pain in the very low back. So standing with our knees relaxed and our hips kind of rocked forward, our lower belly tight, that helps to take the pressure off that junction area and then also keep those hip flexors in a neutral position. So the first stretch that we do takes that similar type pose where we're having a little bit of bend, our feet are under our hips, our knees have a little slack in them, and then you really want to think of tightening your glutes even more. So this is really exaggerating that pelvic rock forward, but we're tightening our glutes until we start to feel that little bit of stretch. At the same time, we want to brace in our back, so it's okay to put your hands on your low back first and then do that nice big glute tighten. I even think of kind of pushing, like I think of pushing my glutes down into my legs. And then as you do that, the chest kind of naturally wants to open up. So let it do that. We're not trying to over exaggerate a back bend. We're just kind of following what that is. So as you take a breath in, you can feel this kind of wants to stretch and reach up, and that's perfect. That's exactly what we want it to do. We want our elbows to be nice and slack to the back. Gives us the added benefit of a little bit of a chest opening, which is also something that gets tight when we're sitting at a computer, driving in the car, those sorts of things. So deep breaths in, just opening that chest, but we're not over exaggerating that back bend. We're keeping our glutes tight, we're keeping our belly tight, and breathing out, just kind of letting those shoulders and elbows drop back, but keeping everything tight. So that's a good gentle stretch. You're not going to feel a ton unless you're really tight. And again, you don't want to force anything beyond. Letting your eyes go up can also help to open up that chest more, and just keeping everything tucked. Your weight should really be back in your heels. You shouldn't be rocking forward. So back in your heels, knees slack, butt tight. And then when you feel ready, just kind of making sure everything stays tight. We're not relaxing anything until we come up. The other one is a standing lunge stretch, and I'll show you a couple modifications for that. So the leg that we're going to be working on, the hip flexor, is the one that goes back. We want to keep our body square to the front. So sometimes it does help to put your arms like this and kind of Make sure, okay, everything's squared. We're not rotated to the side. Everything is square. And again, glutes are important to protect that low back. We want to keep those nice and tight. A lot of times you will already feel a stretch in the front of the leg here. Two things we can do to deepen that. One is bend that knee, and maybe that changes things for you and tighten. You feel more of a good stretch here. Maybe you don't, but just see how it feels. Leg straight, or let that leg bend. So you're kind of coming up onto your toes of that foot that's back and letting that knee bend to almost a 90-degree. Butt's tight, belly's tight. We're kind of pushing things forward. The second thing you can do to kind of add some additional stretch is to raise that arm up on the same side of the leg that we're stretching back. That may give you some additional stretch, and that may be all that you need. If you feel you need more, a little bend to the side. This is where it might be helpful to have a chair, have a wall near you, something to keep balance. You don't want to fall. You don't want to add insult to injury, so make sure you're doing this safely. And just make sure you're breathing as well as you do that. So just holding it 10, 15, 30 seconds, just depends on you. I often find it kind of works better if we come out of a stretch and then go back into it. We don't want to overstrain the body. And you'll just switch and do that on both sides to where you feel it's comfortable. And maybe I just want to go ahead and do that. So again, I like to give a little bend to the knee. That gets it deeper for me, making sure things are squared. Glutes are tight, belly's tight. Breathe that arm up. We exhale, bring it over. And that's kind of the full shebang there. Some people do like to do 2 arms. It's up to you, your balance, what feels good. I feel like it maybe just adds a little extra weight or a pull, but you'll feel that in the front and then getting into those hip flexors in the back as well. So it can really be delightful. So there's a couple standing hip flexor stretches. We'll do some more talking about things that we can do lying down in our next one. All right, hope you guys have a great day.